I'm about to reveal something that could save your life. Right now, while you're watching this video, there's a pill sitting in your medicine cabinet, a pill you probably took this morning, a pill your doctor prescribed, a pill that millions of seniors take every single day. And this pill is slowly, silently, irreversibly destroying your heart. Not damaging it, destroying it. And you won't feel it happening until the day you collapse. I'm Dr. Curtis P. Langlotz, and after more than 2 decades as a cardiologist, I've seen hearts destroyed by medications that were supposed to help. Hearts that should have been healthy. Hearts that were working perfectly fine until a prescription started the damage. And here's what terrifies me. Here's what keeps me up at night. Every single patient tells me the same thing. My doctor said this pill was safe. My doctor said I needed it. My doctor never told me it could destroy my heart. But I'm not going to tell you which pill it is yet. Because if I just give you the name right now, you'll check your medicine cabinet, and if you're not taking that specific pill, you'll stop watching. You'll think you're safe. But you're not safe because there are 6 other medications that destroy hearts in seniors the exact same way. And I'm going to reveal all 7 before this video ends. But first, you need to see what this destruction looks like. You need to understand what's happening inside your chest right now if you're taking any of these pills. Let me tell you about Arthur. Arthur was 74 years old, retired electrician, healthy his whole life, never smoked, kept his weight down, walked 3 miles every morning. But Arthur had arthritis, terrible arthritis in both knees. The kind that makes every step feel like grinding glass, makes getting out of bed an ordeal, makes you dread walking to the mailbox. His doctor said, "Arthur, I'm going to prescribe something for the pain. It'll help you move better, help you stay active." That's important at your age. The doctor prescribed Arthur a common medication, the kind you've heard of, the kind that's advertised during the evening news, the kind that 60 million Americans take, the kind sitting in medicine cabinets across this country right now. Arthur took it exactly as prescribed, twice daily, every single day, and it worked. The pain decreased. His knees felt better. He could walk without wincing. He could work in his garden again. He could keep up with his grandchildren. For 4 years, Arthur took this medication faithfully, never missed a dose, did exactly what his doctor told him. But something was happening inside Arthur's chest, something he couldn't feel, something that didn't hurt, something invisible, silent, deadly. The medication was forcing his heart to work harder, much harder. Every single beat required more effort than it should. His blood vessels were constricting. His blood pressure was creeping up. His kidneys were retaining fluid, and his heart was struggling to keep up. Month after month, year after year, the heart muscle was straining, overworked, like a sprinter trying to run a marathon. At first, Arthur's heart compensated. It's an amazing organ. It can adapt. It can work harder when needed. But there's a limit. There's a breaking point. And Arthur's heart was approaching that point without anyone knowing. Not Arthur. Not his doctor. No one. The first sign was subtle. Arthur noticed he got tired more easily. Walking up his driveway left him winded. He thought it was age, just getting older. Everyone gets tired, right? He didn't mention it to his doctor. Didn't seem important, just normal aging. But it wasn't normal. His heart was failing. The muscle was weakening, losing its ability to pump effectively. The damage was accumulating. Irreversible changes were occurring in the heart tissue. Then Arthur started waking up at night, had to sleep propped up on 3 pillows instead of lying flat. Lying flat made him feel like he couldn't breathe, like there was weight on his chest, like he was drowning. He'd wake up gasping, sit up, wait for the feeling to pass. This happened 2, 3, 4 times a night. His sleep was destroyed. He was exhausted during the day, but he still didn't connect it to his heart. Thought maybe it was sleep apnea, maybe acid reflux. Never thought it was his heart. Why would he? He was taking medication for his knees. What did that have to do with his heart? But here's what was actually happening. And this is the part that should terrify you. This is the part your doctor never explained. Arthur's heart was filling with fluid. The weakened muscle couldn't pump blood forward efficiently. Blood backed up into his lungs. Fluid leaked from blood vessels into lung tissue. Every night when Arthur lay flat, gravity allowed this fluid to spread throughout his lungs. He was literally drowning in his own fluid. That's why he couldn't breathe. That's why he had to sit up. His lungs were filling with fluid every single night, and the medication he was taking for his knee pain was making it worse. Every dose forced his heart to work harder against increased resistance. Every dose retained more sodium, more fluid. Every dose pushed his failing heart closer to complete collapse. And nobody knew. Nobody was monitoring. Nobody was checking his heart function because nobody thought a medication for knee pain could destroy a heart. Then came the day everything changed. Arthur was in his backyard raking leaves, normal Saturday afternoon. He stood up from bending over, felt dizzy, sat down on his porch steps, waited for it to pass. But the dizziness got worse. His vision started narrowing, tunneling, going dark around the edges. He tried to call for his wife, but no sound came out. His wife found him slumped over, unconscious. Called 911. In the ambulance, the paramedics couldn't get his blood pressure above 82 systolic. His oxygen saturation was 76%, should be above 95. His lungs were full of fluid. They could hear it, crackling sounds with every breath, rails, the sound of drowning. They put an oxygen mask on him, started an IV, gave him medication to remove fluid, rushed him to the hospital. The ER doctor took one look at the chest x-ray and knew heart failure, severe heart failure. Arthur's heart was barely pumping. His ejection fraction, the measure of how much blood the heart pumps with each beat, was 22%. It should be 55 to 60. His heart was pumping less than half of what it should. The muscle was enlarged, dilated, weak, scarred, years of damage visible on the echocardiogram. The cardiologist showed Arthur's wife the images. See how the heart barely squeezes? See how thin and stretched the muscle is? This is advanced heart failure. His heart is destroyed. And here's the moment that breaks my heart every time I think about it. The moment that made me want to share this information. The moment that makes me furious at a medical system that allows this to happen. The cardiologist asked Arthur's wife what medications he was taking. She listed them, and when she mentioned the arthritis medication, the cardiologist stopped her. How long has he been on that? 4 years. The cardiologist closed his eyes, shook his head. That medication causes heart failure. We've known this for years. There are black box warnings on it. Your husband should never have been on it for 4 years. His heart is destroyed because of that medication. Arthur's wife started crying, not just tears, sobbing. The kind of crying that comes from rage and grief mixed together. Nobody told us. His doctor never said anything about his heart. Never checked his heart. Just kept refilling the prescription. Kept saying it was safe. How could this happen? The cardiologist had no answer because there is no good answer. This happens every single day across the country. Doctors prescribe medications without considering the cardiac effects, without monitoring, without warning, and hearts get destroyed. But here's what makes Arthur's story even more devastating. Are you ready for this? Because this is going to make you angry. Arthur's arthritis could have been treated differently. There were safer options: acetaminophen, topical creams, physical therapy, cortisone injections, a dozen alternatives that wouldn't have destroyed his heart. But his doctor went straight to the pill that's easiest to prescribe, the pill that drug companies promote, the pill with the highest profit margin. And that pill destroyed Arthur's heart. Now Arthur's 78, lives with severe heart failure, takes 8 cardiac medications every day, can't walk up a flight of stairs without stopping, can't carry groceries, can't rake leaves anymore. His backyard where he used to garden sits overgrown. He doesn't have the energy. His grandchildren come to visit, and he can't play with them, can't pick them up, can barely stay awake for their visits. His life has been reduced to sitting in a recliner, struggling to breathe, waiting for the next hospitalization, because heart failure doesn't get better. It only gets worse. And Arthur's heart is so damaged that he's not a candidate for transplant. Too old, too much damage, this is permanent. And every single day, Arthur asks the same question. Why didn't anyone tell me? Why didn't my doctor warn me? I would have just dealt with the knee pain. I would have done anything rather than this. Now I need you to stop for a second. I need you to really think about what I just told you. Arthur was healthy, active, independent, living a full life, and one medication prescribed for knee pain destroyed all of that, took his independence, took his quality of life, took his future, and he's not alone. This is happening to thousands of seniors right now, today, while you're watching this video. Comment below if you're taking any medication for joint pain or arthritis. I need to know how many people watching this are potentially at risk right now. But here's what I haven't told you yet. Here's the part that's even more terrifying. The medication that destroyed Arthur's heart. You've probably heard of it. You might be taking it right now, or your spouse is taking it, or your parent. It's in 40% of medicine cabinets in America. 40%. That means if you know 10 people over 65, 4 of them are probably taking this medication, and their hearts are being destroyed right now, silently, without symptoms, until the day they collapse like Arthur did. And I'm still not going to tell you the name yet, because Arthur's story is just one of 7 I need to tell you. 7 different medications, 7 different ways hearts get destroyed, 7 different patients whose doctors said the medication was safe, And all 7 medications are commonly prescribed to seniors. All 7 are considered routine. All 7 are destroying hearts right now. But before I tell you the second story, I need to explain something about Arthur's heart, something that explains why this medication is so deadly for seniors specifically, something that shows why what's safe at 50 becomes deadly at 70. When you're young, your heart has reserve capacity. It's like having a car engine that can rev to 7,000 RPM, but you normally only use 3,000. You have extra buffer, protection. But as you age, that reserve disappears. By age 70, you're using most of your heart's capacity just for normal daily activities. There's no buffer left, no protection. So when a medication forces your heart to work harder, even just 10 or 15% harder, there's no reserve to draw from. The heart fails. Immediately, catastrophically. Arthur's heart had no reserve left. At 74, he was using 90% of his cardiac capacity, just living normally. When the medication forced his heart to work 15% harder, he needed 105% capacity. But you can't exceed 100%. The heart can't give more than it has, so it failed. The muscle stretched, dilated, weakened, permanent damage. And this same process is happening right now in millions of seniors taking this medication. Hearts stretched to their limit, one prescription away from Arthur's fate. Now let me tell you about Evelyn, because Evelyn's story shows what happens when the damage is even worse. When the medication doesn't just cause heart failure, when it actually kills parts of the heart muscle, when it creates permanent dead zones that can never recover. Evelyn was 69 years old, had high blood pressure, nothing severe, just 144/90. Her doctor wanted to get it under control, said, "Evelyn, high blood pressure is dangerous. We need to lower it. I'm going to start you on medication." Evelyn agreed. Of course she agreed. High blood pressure is bad. Everyone knows that. You should lower it. That's what doctors always say. The doctor prescribed Evelyn a blood pressure medication, a common one of the most prescribed in the entire country. Evelyn took it faithfully every single morning, never missed. Her blood pressure came down beautifully, 126/78. Perfect numbers. Her doctor was pleased. "Keep taking it, Evelyn. It's working great." Evelyn felt proud. She was taking care of her health, doing everything right, following doctor's orders, being a good patient. But inside Evelyn's chest, something terrible was beginning. Something nobody could see. Something that wouldn't show up on a blood pressure cuff. The medication was affecting her heart muscle directly. Specifically, it was affecting the calcium channels in her heart cells. These channels control how the heart muscle contracts. When they're blocked by medication, the contractions weaken. The muscle doesn't squeeze as hard, and over time, over months and years of weakened contractions, the muscle begins to change. At first, the changes were microscopic. Individual heart cells struggling, working harder to compensate for the blocked calcium channels. But cells have limits. And when you push them beyond those limits day after day, month after month, they don't just get tired, they die. And when heart muscle cells die, they don't regenerate. They're replaced by scar tissue, non-functioning tissue, dead zones in your heart. For 5 years, Evelyn took this medication. 5 years of her heart cells dying slowly, 5 years of scar tissue accumulating, 5 years of her heart muscle being replaced bit by bit with useless fibrous tissue that can't contract, can't pump, can't do anything except take up space where functional muscle used to be. And Evelyn felt fine. That's what makes this so insidious, so evil. You don't feel your heart cells dying. There's no pain, no warning. Your heart compensates. The remaining healthy cells work harder, pump faster, maintain blood flow. You feel normal. Meanwhile, your heart is being destroyed from the inside out, cell by cell, beat by beat, silently. Then Evelyn started feeling tired, exhausted all the time. She thought it was her age, just getting older. Maybe she needed vitamins. Maybe she wasn't sleeping well. She mentioned it to her doctor. The doctor ordered blood work, checked her thyroid, checked for anemia. Everything came back normal. "You're fine, Evelyn. Just aging. Maybe try to exercise more. That'll help with energy." But exercise made it worse. Evelyn would try to walk around her neighborhood, used to walk 2 miles easily. Now she couldn't make it halfway around the block without needing to sit down. Her legs felt heavy, her breathing was labored, her heart was pounding. She felt like she was going to pass out. She stopped trying to exercise, thought maybe she was just too old for that anymore, accepted that her active days were behind her. What was actually happening? Evelyn's heart was failing. The years of calcium channel blockade had killed so much heart muscle that the remaining muscle couldn't maintain adequate cardiac output. Her heart was pumping, yes, but not effectively. Not enough blood was reaching her muscles, her brain, her organs. Everything was starving for oxygen, and the exertion of walking revealed this. Her dying heart couldn't keep up with even mild exercise demands. Then one day, Evelyn was at the pharmacy picking up her prescription. Walking down an aisle, she felt a strange sensation, not pain, just strange, a fluttering in her chest, a sense of something wrong. She stood still, waited for it to pass, but it got worse. The fluttering became stronger. Her heart was racing, pounding. She felt lightheaded, dizzy. The room started spinning. She grabbed the counter to steady herself, tried to call for help, but before she could speak, her legs gave out. She collapsed, hit her head on the floor, lost consciousness. Other customers saw her fall, called 911. Paramedics arrived, found Evelyn unconscious. Her heart rate was 184, dangerously fast, irregular, chaotic, atrial fibrillation. Her heart's upper chambers were quivering instead of beating, blood pooling instead of flowing, clots forming. The paramedics started an IV, gave medication to slow her heart, put her on oxygen, rushed her to the hospital. In the ER, they did an echocardiogram. What they found shocked everyone. Evelyn's left ventricle, the main pumping chamber, was barely moving, barely contracting. The walls of the chamber were thin, dilated, stretched out like a balloon, blown up too big. And throughout the muscle, they could see areas that weren't moving at all. Dead zones, scar tissue, places where the muscle had died and been replaced by fibrous tissue that can't contract. The ejection fraction was 28%, should be 55 to 60. Evelyn's heart was pumping less than half of what it should. The cardiologist came in, sat down with Evelyn and her daughter, showed them the images. Evelyn, you have severe dilated cardiomyopathy. Your heart muscle has been damaged, extensive damage. The muscle is weak, thin, not functioning properly. This is why you've been so tired, why you collapsed today. Your heart can't pump enough blood to sustain you. Evelyn was crying. How did this happen? I don't understand. I've been healthy. I take my medications. I've been doing everything right. The cardiologist looked at her medication list, saw the calcium channel blocker, asked, how long have you been on this? 5 years. The cardiologist's face fell. This medication can cause cardiomyopathy in some patients, especially in older adults. It blocks calcium channels in the heart muscle. Over time, this can cause progressive muscle damage. In some people, the damage is mild. In others, like you, it's severe. Evelyn couldn't believe it. My doctor never told me this medication could damage my heart. Never mentioned it. Just said it was for my blood pressure, said it was safe. The cardiologist said it is safe for most people, but not everyone. Some people are genetically susceptible to this side effect, and we don't always know who those people are until the damage happens. That's why we're supposed to monitor heart function in patients on this medication long term. Did your doctor ever check your heart function? Never, not once in 5 years. And now Evelyn's heart is permanently damaged, irreversibly damaged. She stopped the calcium channel blocker immediately, but the damage was done. The dead heart muscle doesn't come back. The scar tissue doesn't turn back into functional muscle. Evelyn is 74 now with the heart function of someone dying from end-stage heart failure. She needs a heart transplant to survive long term, but at 74, she's not a candidate, too old. This is how she'll live for whatever years remain. Severe heart failure, barely able to function, trapped in a body that can't keep up with even the simplest activities. And the medication that did this, the medication that killed parts of Evelyn's heart muscle, it's still being prescribed right now, today, to thousands of seniors, many of whom will develop the same cardiomyopathy, the same permanent damage, the same irreversible heart failure, because doctors keep prescribing it without monitoring, without checking heart function, without warning patients of the risk. Comment below if you're taking any blood pressure medication. Tell me which one. I need to see what people are on so I can help you understand your risk. Now think about this. Really think about it. Evelyn went to her doctor for high blood pressure, 1 or 44/90, mild elevation. Could have been managed with diet and exercise, could have been treated with safer medications, could have been left alone and she would have been fine, but instead she was given a medication that destroyed her heart, killed her heart muscle, created permanent disability, ruined the rest of her life, all to lower her blood pressure by 18 points. Was it worth it? Was 18 points of blood pressure reduction worth destroying Evelyn's heart? Worth stealing her independence? Worth making her last years a struggle to breathe? Of course not. But this trade happens every day. Doctors prescribe medications without considering the full cost, without weighing the risks against the benefits, without thinking about what happens when the treatment is worse than the disease. And I'm still not telling you which specific medications these are. Not yet, because you need to understand something else first, something critical. These medications aren't dangerous for everyone. Some people take them for years with no problems, no side effects, no heart damage. But some people, and we don't always know who, are devastatingly susceptible. Their hearts are destroyed by medications that other people tolerate fine. And the only way to know which group you're in is to monitor. Check heart function regularly, watch for early signs of damage. But that monitoring doesn't happen. Doctors prescribe and forget, refill and repeat, and hearts pay the price. Let me tell you about Bernard because Bernard's story shows yet another way medications destroy hearts in seniors, a way that's even more insidious, even more unexpected, even more common. Bernard was 77 years old, had acid reflux, bad reflux, heartburn every night, burning in his chest, acid coming up into his throat, affecting his sleep, his quality of life. His doctor said, "Bernard, I'm going to put you on a proton pump inhibitor. It'll reduce your stomach acid, get rid of the heartburn. You'll feel much better." Bernard was grateful, started taking it. The heartburn disappeared immediately, like magic. No more burning, no more discomfort. Bernard was thrilled. Took this medication every morning for 9 years, never had heartburn again. But inside Bernard's body, something was going wrong. The medication was blocking acid production in his stomach. That was the goal. That's what it was supposed to do. But here's what nobody told Bernard. Here's what his doctor either didn't know or didn't think was important. When you block stomach acid long term, you block the absorption of critical nutrients, specifically magnesium. And magnesium is absolutely essential for heart rhythm. Every heartbeat is controlled by electrical signals. These signals depend on the balance of electrolytes: sodium, potassium, calcium, magnesium. When magnesium drops too low, the electrical system becomes unstable. The heart starts misfiring, beating irregularly, chaotically, and Bernard's magnesium was dropping, slowly, month by month, year by year. The proton pump inhibitor was blocking its absorption. His body's stores were being depleted, and nobody was checking. Nobody was monitoring his magnesium level. Your heart is precious, irreplaceable. Once damaged, it doesn't fully recover. Arthur knows this. Evelyn's family knows this. Bernard knows this. I know this because I've seen it happen over and over again in my career. Hearts destroyed by medications that were supposed to help. Lives ruined by prescriptions that were supposed to be safe. Families devastated by deaths that were completely preventable. Don't let this happen to you. Review your medications. Talk to your doctor. Get monitoring. Find alternatives. Protect your heart before it's too late. Subscribe to this channel because I'm committed to sharing the information your doctor might not know, the warnings that don't make it into the standard guidelines, the research that shows which medications are actually safe for seniors and which ones are destroying hearts. Leave a comment telling me what medications you're on, what you're going to ask your doctor, what changes you're going to make. Your comment could help someone else in the same situation. Share this video with everyone who needs to see it. Your parents, your spouse, your friends, anyone over 65, anyone on multiple medications. This information could save their life. Thank you for watching. Review your medications today. Question everything. Protect your heart. I'll see you in the next video where we continue taking control of your health together.